So good morning, Vincent, and thank you so much, for taking the time, to do this, to do this session with me. Okay. So before we start, could you briefly introduce yourself and tell us about your work in nutrition?
Thank you so much, for having me. My name is Vincent Adocta Awuuh. I'm a registered dietitian, nutritionist, with over 13 years plus experience working across hospitals, in the community, in education, and in research in Ghana, and then now in the UK, Bristol to be precisely. I'm currently working as a remote dietitian for a digital health platform that serves over 40,000 plus population across over 40 countries across the globe. So in brief, this is who I am.
Yeah. Thank you so much for the introduction. So my next question is to ask you that, so in your opinion, because I know that your expertise, in nutrition and also you are a dietitian. So how has AI changed the way nutrition or dietitian professional work? Yeah.
Yeah, I think AI is actually a valuable tool if it is used ethically and in the right context. I can say personally to me, in my practice as a dietitian nutritionist over the past years, since I came in contact with AI, it has actually helped in reducing time spent in doing things like taking note, trying to do some assessment. So that time is rather now channeled to having more conversation, building more rapport with the client, and trying to give more attention to the client instead of paying attention to note taking and documentation. So AI is actually a very good tool if it is used ethically.
Yeah, I see. So how about in terms of, let's say, maybe teaching and learning, research, and also in higher education? So what do you think that, for example, like how should universities prepare, our future nutrition professional to work alongside with AI?
Yeah, this is a very important area and a good question. I think it is good that universities incorporate AI teachings in the curricula so that students can be taught how AI can be used to generate information, as well as how students will be able to detect whatever information that is being generated to validate it against, let's say, sources like we do in traditional literature, to be able to identify information that is generated from AI, how to be able to detect whether this is a genuine or this is authentic information as against to generalized information. So it is good that universities incorporate AI into the various curricula and to partner, especially in the field of nutrition. Students can be taught of how the AI can be used in the nutrition care process, and then how to be able to interpret that the information that is being generated, to be able to compare that against guidelines, standard guidelines like WHO guidelines or the British Association guidelines, to be able to know that this information that is generated is actually an evidence-based information, but not a generic information that to be taken by everybody.
I see. Yeah. You have made some very good points there. And then, so what do you think about, for example, like, do you think that AI can help to improve population nutrition and also reduce health inequalities?
I can say to this, it depends on how AI is implemented. If it is implemented well, it can actually be able to break that inequality gap. But if it is not implemented deliberately, it can end up widening the gap. Why am I saying this? AI, as I said, can help to reach out population that the actual or the human being physically wouldn't have been able to get. In the work that I currently do, I do online consultation across the globe. So I have some clients coming from Africa, Europe, and other parts of the world. and through AI, I'm able to rate them, be able to understand some of their food, and then to be able to give them the appropriate advice. That is if it is used and used well, and the information that is often generated is validated, not just taking it line, hook and sink, and then wholly, but it needs to be validated. So if it is deliberately, if it is used well, it can actually bridge that gap and reach a lot of population. But why I'm saying it can also widen the gap is that we have minority groups or underserved communities that if AI is not able to capture everybody, we have certain cultural foods across the world. So if AI is not able to actually capture all this into or taking this into consideration, it can end up widening the gap by either producing unreliable information, because if those information are not captured, like languages that are not captured, it means that those people are not going to be actually included, and it can end up widening the gap. So I'll say yes, possibly AI can help to reach high or reach population level if it is deliberately implemented well to be able to take everybody into consideration across the length and breadth of the world.
Yeah, I see. Yeah. So in terms of challenges and also ethics, okay, how reliable are are these AI generated dietary recommendations in your opinion?
Yeah, I can say AI information, you need to have the technical eye to be able to tell that this information generated by AI is actually good for your client, or you need to do additional patches to it. Just like I said earlier on, so starting from the university level. So if universities are able to incorporate it and teach before you come back from school, at least you have an idea as to how to evaluate AI information to compare with other evidence-based information, other standards, to see if it is well or if it is a good information or not. So like you said, so AI information can be most of the AI tools, like for instance, chat and other Google AI tools, they often produce generalized, let's say, information. So if you are a nutritionist, dietitian using AI, you should be able to know the kind of case you are dealing with and the information that you're going to generate from AI. So that it's not just every information that you get from AI, you take everything cut and paste, but you should still be able to have that clinical reasoning to be able to look at the data and compare it with standardized guidelines to be able to know what to add and what to take off before it ever get to your client for consumption.
Yeah, I totally agree. So my last question. So in terms of practical advice, so what advice would you give, let's not to the future or the current nutrition professionals who would like to start using AI in their practice?
Yeah, so my candid advice would be number one, to always verify whatever output that you get from AI by comparing it with other guidelines, to the WHO guidelines or other standardized guidelines before it reaches the patient. And also never to input identifiable patient data into general AI tools, because ethically data protection is something that you should guide as a professional, and then to also keep the human aspect in mind when dealing with your client, because no matter how, though AI is good, if you know how to interpret the information that it generates, but to me it can never replace the role of the human, the dietitian or the nutritionist, because the human aspect need to always be kept in mind. So AI should free up some time for you so that you can have more relationship with your client, instead of replacing the human part with totally AI generated information, which sometimes can be general, which might not be personalized. But the patient may need personalized information based on the condition, medication, whatever the client is taking. So the nutritionist or dietitian is still valuable when it comes to the care of the patient.
Yeah. No, that's very good advice. Yeah. So no, that's all I want to ask you today. No, and listening to you, because you're an expert in this field. So do you still have anything else you want to add? Yeah, before we close today's session.
Yes, I said thank you so much for this opportunity. But just to sum it up, the nutritionist dietitian will only be needed. AI is a tool that can help you to give like draft guidelines. It's like your second let's say assistant, but not to replace you. So it is always good. Whatever the AI gives you, you cross-check it, and you should know how to cross-check that. Thank you.
Okay, yeah. Thank you so much for your time. I'm going to stop the recording now. Okay.